And the good news is it's telling us that influenza continues to decline following this very strong early peak that we saw in November and December. RSV has continued to stay high. It's now at where we would expect it to see this time of year, and it's leveling off. And COVID has remained relatively stable the past several months, and I'll just talk about these in a little bit more detail. So in terms of influenza, our data indicate from these various different sources that influenza in all age groups has steadily declined from the peak where we saw about 27% test positivity in late November down to we're about 5% now. So of all those tests that are done, about 5% of them are positive for influenza. This has been a very unusual year, so it is very important to recognize that we can't necessarily compare this year to previous influenza seasons prior to the pandemic. We knew, and we talked about this in September and October, that we saw a very similar, unusual pattern in Australia and New Zealand during their influenza season their last winter. And we knew that this was a possibility, and that was one of the things that we were planning for, and I know the Minister will talk about impacts on the health system. So we did see that very rapid increase, and thanks to many people getting vaccinated and what we did, we've started to see decreases across age groups, and particularly in children who've been affected by influenza, as we know, leading to hospitalization in many, many children. And we know now that this is largely because there is a whole cohort, several cohorts of children who were never exposed to influenza because of all the measures we had in place, and particularly the restrictions on travel globally. Influenza didn't spread through the first 2 years of the pandemic. So there's people whose immune system haven't developed that protection that they needed. The other thing that I think is important is that influenza A, H3N2, is the one that's been causing most illness and the one that's thankfully decreasing. And, that is the strain of influenza that we see that most likely causes severe illness, particularly in children who've never been exposed to it before and in older people. And we also know that there are other strains of influenza, and we often see later in the season that we'll see another wave of influenza B. So we're watching for that, and so far we've not seen a lot of it, but it does tend to happen later in the season, and it tends not to be as severe because most of us have had some exposure to influenza B at some point in our lives, and it doesn't change as quickly as influenza A. So we're continuing to monitor for that. We have, as you know, put in active surveillance to look for severe illness in children after the pediatricians, particularly at Children's Hospital, raised the alarm with us that they were concerned that they were hearing about very severe illness and deaths in children in early December. And we have not seen any additional deaths beyond the 6 that were initially reported that we linked to influenza early on in the season. So that's important and thankful. So the other thing that I do want to mention is because we had such an early rapid season, our Sentinel Physicians Practitioner Surveillance Network, we were able to do some vaccine effectiveness on that and the work that the BC CDC and Dr. Skowronski's team, and it showed that early estimates show that the protection from the vaccine that we have right now reduces your chances of needing to see a physician or a nurse practitioner for influenza, cuts that risk by at least half. So that's the good news. And for those who've not yet been vaccinated, it's still available and important to do that. In terms of RSV, respiratory syncytial virus, while we are seeing a decrease in influenza, RSV remains relatively high, although it is also leveling off and is causing less illness in children, which is also important and good news. And it's about where we would expect it to be at this time of year prior to the pandemic. So RSV is another one of those respiratory viruses that when we stopped travel and we stopped gatherings and we had all of those measures in place, it didn't circulate very easily either. And now we're going back to a more normal season. And unfortunately for us, the start of RSV was at around the same time that we were seeing this unusual and dramatic spike in influenza as well. So children who would normally have been exposed over the last 2 years weren't. And so they didn't have that immunity. And what we're seeing is it's, again, a cohort effect where there were many more children and slightly older children who were susceptible. And of course, as it started early on, and we know that that made a tremendous impact, particularly on children's hospitals. And just to remind people that the emergency departments are still busy, and they have put in place measures to make sure that we can quickly and effectively triage children. And if you need, if your child is ill and needs to be seen, don't be afraid to go to the emergency department. But also know that your child's illness can be treated by a doctor's office, a walk-in clinic, the urgent primary care centers, or if you need immediate medical advice, you can contact HealthLink at 811. And so finally, COVID is the other major one that's been added to the respiratory viruses that we are likely to see, at least for the next number of years. And COVID-19 has remained relatively stable over the last 3 months. Hospitalizations increased a bit at the same time that we were seeing hospitalizations for influenza and RSV increase in December, but are now slowly coming back down. And we look again at the many different sources of information, and particularly things like the wastewater surveillance, which is not dependent on testing, and it shows a slowing and a decrease across much of the Lower Mainland, which is in keeping with the same thing we're seeing in visits to clinics, in long-term care outbreaks, and in the testing data that we have. So all of these pieces together tell us that we're slowly decreasing the same thing across time. And really, this is thanks to people stepping up and being vaccinated. I can't overestimate the importance of having those booster doses in effectively blocking the transmission in our communities. I want to, and along with that, I want to talk a minute about the XBB 1.5 variant, because it's been on a lot of people's minds over the last few weeks. To date, we've had 24 confirmed cases. So those are ones where the test has been done and we've done the whole genome sequencing that shows it's this specific subvariant. And it's important to note that this doesn't reflect the total number of cases in the province. This is surveillance data. So this gives us a sense of what proportion of the tests that we're doing, the whole genome sequences, turn out to be this one. And we saw the first ones in late November, early December, and we now have found about, it's up to about 5 or 6% of the whole genome sequences are this variant. The most that we're seeing here, 95% of what is causing illness in the province is still the BQ 1.1. All of these are subvariants of Omicron. And I think that's really, really important. And while this XBB 1.5 has garnered a lot of attention, it still remains a subvariant of Omicron. So what does that mean? Any new variant that has an advantage spreads more easily. That's what viruses do. They change to try and reproduce themselves more quickly. And if it spreads more easily, it often will replace the ones that went before it. So each new one that spreads, by definition, is the most infectious one to date. And we've seen that with XBB 1.5. So why does it take off in some places and not in others? A lot of it has to do with the defenses that we have in our community. And importantly, there is no evidence that this subvariant is causing more severe illness. And there's very good evidence that our vaccines are still providing strong protection from serious illness and death, especially if you've had the bivalent booster that has that Omicron antigen in it. So if you have not yet had that, then you need to get it. So we must remember that these new strains may make us more vulnerable to infection, but they don't render us defenseless. The defenses we have built through immunization and combinations of vaccine immunity and infection-induced immunity means we have strong defenses as a community across this province. We are no longer in a place where we needed to take extraordinary measures because everybody was susceptible and many, many people could get seriously ill, need hospital care, or die. And as we talked about, hospitalization due to COVID-19 is decreasing. And even though it is decreasing, we know our hospitals are stretched. It's not surprising this time of year. We traditionally experience an increase in hospitalizations in January as people access care after the holiday period. And it often coincides with an increase in respiratory illnesses. And usually this is when we would start to see influenza really taking off as well. People delaying seeking treatment over the holidays because of the weather is one of the issues, or in challenges in accessing care. And again, of course, surgeries ramping up again after the holidays slow down. And also, I will mention, we've been seeing norovirus, so this gastrointestinal illness causing effects as well. So as we get back into our regular activities following the holidays, it is important to continue to take measures to protect ourselves and others from respiratory viruses and other infections. First and foremost, getting vaccinated, getting that booster dose if you haven't already. These boosters make a difference. If you're feeling unwell, whether it's from a respiratory virus or fever and a rash or GI upset, nausea, vomiting, stay home, stay away from others, and particularly avoid contact with people who are more vulnerable to severe illness themselves. It's so important, and I say this how many millions of times, to regularly wash your hands, practice proper respiratory etiquette, covering our coughs, properly disposing of tissues. We can also wear masks, especially in crowded indoor spaces when there's poor ventilation. You can wear masks for yourself for additional protection if you're somebody who is more at risk, and for others if you have mild symptoms of what could be a respiratory virus or are still recovering or have had contact with somebody at home who's ill.